Hi and welcome to today's webinar. Today I'm going to be covering the adolescent adult sensory profile. You might have noticed that recently all of the webinars on pearsonclinical.com.au have not been working due to some changes to the platform. And in that case, we've actually lost quite a few of our webinars, including this exact one. So I'm just going to be covering an overview of the assessment today, and all of the available webinars are on this YouTube channel now for your reference. So today I'll be providing an overview of the adolescent sensory profile. We'll go through some administration and scoring, interpretation, implications for clinical practice, and also some case studies. So the adolescent sensory profile measures sensory processing abilities by self-report, unlike the sensory profile 2, which is completed by a caregiver or parent or teacher. It profiles the effects of sensory processing ability on functional performance in everyday life and gives information about a person's tendencies to respond to stimuli and which sensory systems are contributing to or creating barriers to functional performance. It also provides standardized quadrant scoring, so between much less than most people to much more than most people. So who's it for? It is for individuals aged between 11 and 65. You'll find that it has a slight overlap with the sensory profile 2 in age range. Begins at ends at 14 at the sensory profile 2. So it really is up to the clinician to decide which is the better or more appropriate method in terms of being a self-report, or whether a teacher or a parent or caregiver is the more appropriate respondent for the assessment. It's for people with physical disabilities, with psychiatric conditions, or with no identified disability at all. In fact, I would recommend every therapist to complete one on themselves, just so they can get some practice on being able to interpret the findings. The sensory profile should be used to establish a baseline of sensory processing in everyday situations, to guide your intervention and clinical decision making, to raise awareness of sensory processing as a contributor to behaviour for both clients and staff, and or to assess whether sensory processing patterns are compatible with a daily living situation. It measures all of the senses, i.e. taste, movement, visual processing, touch processing, activity level, and auditory processing. It's really important to note that everybody has a sensory profile, including yourselves, and everyone sits along a continuum. So the great thing about Winnie Dunn is she sees sensory processing from a strengths-based approach. It's not observed as a dysfunction, and so she likes to emphasize that everyone will sit along that continuum somewhere. So here's a great visual representation of Winnie Dunn's framework based on the adolescent adult sensory profile. You'll find that it is different to the updated version, and some of the quadrants are also a little bit different. However, it is still based on the two different continuums. So on that horizontal axis, you have the behavioural response, whether that be passive or active, and then you have the threshold on the vertical axis, so high threshold or low threshold. You also then have where the person falls within each quadrant. So that low registration, sensation seeking, sensory sensitivity, sensation avoiding, which we'll go through now. So that low registration quadrant represents a high neurological threshold. You can think of a threshold as being like a cup. So someone with a really high neurological threshold will have a large voluminous cup, and low registration will have a passive behavioral response, i.e. they'll typically let the stimuli pass over them, won't be bothered by it, and they'll then tend to miss that sensory information, such as things like I don't smell things that other people say they smell, they don't hear their name when they're being called, etc. That seeking quadrant represents high neurological thresholds. So again, they have a really large cup, but they have that active response. So they'll be continually actively adding sensory input to their tasks, such as adding spice to their food or fidgeting or doing things like jumping off a cliff, which you can see in that image there. Within the sensitivity quadrant, this represents low neurological thresholds. So again, going back to the cup, it's quite a small cup, and passive response represents again that behavioral response to stimuli. So they can be continually detecting sensory input. They tend to startle easily and find it quite difficult filtering out input from their environment. The avoiding quadrant is a low neurological threshold again, but they have that active response. So you'll find that they withdraw from overwhelming sensory experiences. These people tend to like routine and structure, so they know exactly what to expect. And like the example here, they tend to eat more familiar foods and like to stick to a specific structure in their day. So administration comes in two different forms. As I hope you'd know, all your purchases are completed on pearsonclinical.com.au, and then within that you have your different purchasing options. So the first option is that paper-based format. You can purchase a kit, or you can purchase the manual and their forms separately. It's up to you and what you need. And then you have 4 different options of administrating that assessment. So the first option is to give the questionnaire to the client with a covering letter to explain what it is, and then they can complete that within their own time and give it back to you. Second is to have the client complete it with you present. The third is to conduct it in an interview format, and the fourth is within a group setting. Another great option is that online administration. So with this, you're still purchasing your online summary report, and then you are set up with a Q Global account, which is the platform on which you administer the assessment. The great thing about this is that you don't, for people that are completing it within their own time, you're able to send them an email link so they can complete it and send it back to you for you to generate a report. So the options are 1, for them to complete it in their own time, 2, to have the client complete it on screen with you present, or 3, to conduct it in an interview format on screen. So it's really important with administration that you're explaining the purpose of the assessment to your client. You're explaining the scoring keys and the frequencies so they know exactly what to allocate to each response, i.e. frequently is 75%, etc. So really familiarize them with those scoring keys so they have a great understanding and are answering appropriately. Really emphasize the importance of completing all the items, as this can lead to not having an accurate summary report, and then the clinician will typically have to go back and follow it up, so it can take a lot more time. And also really encourage the addition of comments so that you have that qualitative information as well to back up the quantitative data from it. So here's a better look at the scoring. And the scoring reflects the continuum of possible responses to a sensory stimulus. So almost never is allocated to that 1 point, seldom is allocated the 2 points, occasionally allocated 3, frequently 4, and almost always 5. So the sensory profile scores are based on the bell curve, which you can see to the right of your screen here, and that plots your client in terms of their typical performance comparatively to the population. So you can see that a typical range of performance is within one standard deviation of the mean, either above or below, and that accounts for 68% of the population. You then have more or less than others as being 1 to 2 standard deviations above or below the mean. So that's accounting for 14% of the population. And then you have that much more or much less than others category, which accounts for 2 or more standard deviations from the mean, or 2% of the population. So if in the case you are completing a physical form, to be able to interpret your results, you're going to want to complete the quadrant grids with your scores, your raw scores, and then you use the quadrant summary chart to compare that score against the norm group for each age range. You'll then plot those scores on a quadrant profile, which gives you that visual representation, and then you will use that Appendix B, which will provide further analysis within each of those sections. So as most of you would probably know, if you've completed an adult-adolescent sensory profile, the interpretation is definitely the most challenging aspect of it. But within that, there are some things that you really need to remember. The first point is about the scores themselves and the quadrants themselves. They don't in themselves identify a difficulty or impairment, and Winnie Dunn, the author, has really solidified this within her framework in that it is a strength-based model that both the sensory profile 2 and the adolescent sensory profile are built upon. So within that, we need to step away from that dysfunction model where we look for dysfunction indicated maybe by whether someone receives a much more than others or a more than others within any of the quadrants. We need to look at how their sensory processing is actually impacting on their day-to-day function, and also whether it has an impact to that person's goals as well. So within the interpretation, remember that all sensory processing preferences have advantage and disadvantages. Low scores are just as meaningful as high scores. And also consider what other factors might contribute to these results, whether that be someone's cognition, whether that might be any other diagnoses that might be contributing, whether that might be a history of trauma, etc. So in this, step away from that dysfunction mindset, step away from looking looking at these results to determine, I guess, what might be quote unquote wrong with someone, and look at it as providing you with more information as to how this person experiences their day-to-day life. So quadrant scores are independent of one another, and they're not part of one continuum. So you won't get a total score like you would in a lot of other assessments. Each of the quadrants will have their own score and their own continuum. So every person has an aspect of each quadrant within their sensory processing pattern, and you might find in some cases that someone is much more than others within every quadrant, or two quadrants, and that's where it's really important to delve a little bit deeper into that functional difficulty that the person's struggling with. So within the interpretation of the quadrants, think of all the quadrant patterns, not just as a main one, which is what I touched on in the previous slide. Use the combined profile of all four quadrants to describe the person's sensory processing preferences, and also use that as an umbrella. So within your report, you don't need to always link back to the quadrants in terms of much more than others or more than others. You need to think about, okay, well, does this speak to the person's function and participation, and does this impact on their performance? Because if you're having a result that might be more than others and much more than others in any of the quadrant, but is not actually relevant to the purpose of your referral or the person's function, then it's probably not worth elaborating on. So here's an example of the Appendix B I was referring to previously, and this just provides a bit of a visual representation of a person's processing, and it's separated into each of the different areas. So you can see on the right, this is the touch processing pattern grid, and it breaks it down into that neurological threshold, into that behavioral response, and plots the numbers so you can see how that person is responding to each of the items, as well as on the right, plotting it into that quadrant side as well. So this allows the analysis of performance within different sensory modalities and compares thresholds and behavior responses. Oh, excuse me. When you complete this on Q Global, this is done for you, so it is a little bit more time effective. You also want to think about the environmental context of the assessment. So if a teacher is completing it, it's obviously the context of the classroom. You want to think about other contributing factors that might be impacting on those results compared to, say, a child's response, an adult's response or an adolescent's response at home compared to school. Because these sensory processing patterns might be impacted differently across these environments. It's also really important to consider the context, the environmental context of the assessment. So you'll find that if it's a teacher completing the assessment, it's going to be specific to the classroom, so there'll be specific sensory stimuli within that environment, such as might be bright posters on the wall, you might have really loud children playing, you could even have someone sitting really close to the client and pinching or poking them. And then if you have a respondent like a caregiver, a parent, they're speaking maybe to the community or to the home environment where there are other specific stimuli, such as maybe siblings, could be animals, could be loud televisions, meals being cooked, that sort of thing. So it's important to note that the sensory processing patterns may impact participation differently across these environments. just going to delve a little bit deeper into the different quadrants and what they mean. So first starting off with our registration quadrant. Less than others, you will find that they're typically more observant than others. They notice things that may not be relevant, but they won't be overwhelmed by this. So the similar to others in registration will typically notice enough input to support participation, but they won't be overwhelmed. And then more than others may miss sensory input needed for participation. Within the seeking quadrant, less than others may not seek input. They might show reduced interest and motivation in sensory activities. Similar to others, they might use sensory input to gather information needed for participation, which would be typical. And then more than others may seek input in ways so excessive that participation is compromised. Within the sensitivity quadrant, less than others are more able than most to block out competing stimuli and maintain focus, but they might need support to notice subtle details. Similar to others, they can detect enough input to enable participation, and more than others might be so distracted by input that their participation is disrupted. Within the avoiding categories, less than others may fail to limit input despite overstimulation. Similar to others, obtains and tolerates sufficient input to enable participation, and more than others may be so overwhelmed by input that participation is compromised. In order to build intervention based off the results of the assessment, one thing I like to recommend is for clinicians to start looking also at the item level within the interpretation, as this provides a lot more information and can open up discussions with family as well, so that you can, I guess, find additional information. So don't just focus on, is a child or an adult or an adolescent more than others, much more than others, etc. You want to first have your hypothesis, make sure that your findings are, and that hypothesis, also links back to their function and how it impacts their participation in day-to-day function. You then want to link that back to the purpose of completing the assessment, and then make sure that what your findings are within that are relevant. So it doesn't matter if someone is scoring more than others, much more than others in every single quadrant. You just need to talk about what is relevant to your findings. So a lot of the time I see people really trying to explain what the assessment is and explain every single detail that relates to the findings, and break that down by quadrant, and then kind of extrapolate what things may look like. What I encourage you to do is only talk about what you do know and what is relevant. So try not to talk about the maybe, and talk about what you've seen and what you've heard from family members and teachers, and then link that back to what you've seen within the results, and use that to build your intervention. What I don't also like to see is cutting and pasting of the intervention guides within the manual. Use those to kind of guide your thinking about appropriate interventions based on the results, but make sure that it's specific to the client, make sure it's specific to their participation, and that it is measurable and achievable, all of those SMART goal kind of things. And also think about making those interventions really clear and concise, and not including too many. I see a lot of the time people have 10 to 20 different recommendations of interventions, and that's just unrealistic for a client's parent or teacher to put into their day-to-day life especially if they've got other children and a lot on their plate already. So think about that 1 to 3 interventions that are specific and that are backed by the results as well. This is a bit of a summary of the key characteristics of each of the quadrant scores and the focus that should be centered around your intervention. So for someone who is scoring more within registration, the key characteristics are that they notice less, and therefore the intervention focus should be to increase the intensity of that stimuli. With someone that has scored less than within registration, they notice things more, and therefore you need to increase the familiarity of that stimuli. With someone who is scoring as more than within seeking, the key characteristics is that they're seeking that input, and therefore you need to increase the opportunities of that. For someone that's seeking less, their key characteristics are that they are typically showing less interest in stimuli, and therefore you need to increase the variety of the sensory stimuli. For someone that has scored more than within sensitivity, the key characteristics are that they are detecting stimuli more, and therefore the intervention focus needs to be around increasing that structure. For someone who is scoring less than within sensitivity, the key characteristics is that they are detecting stimuli less, and therefore you need to increase your the awareness within that intervention. And lastly, for someone who's scoring more than within avoiding, you'll note that they are bothered more so by sensory input, and therefore within the intervention focus you need to look at just decreasing stimulation. And for someone who's scoring less than within avoiding, they're less likely to withdraw, and therefore it's recommended to provide organised input. Thank you for your time and attention today. It's been great to talk a little bit more about the adolescent sensory profile. You have my email address and contact details on the screen in front of you, so please feel free to get in contact with any further questions. Thank you.